Hi, my name is Megan. This is my soap note presentation for week 4. So my presentation this week is on a pediatric patient who came in with difficulty breathing with exercise. So identification, initials are TA, age is 2, race Hispanic, gender female, date of birth 1/1/2020. So obviously the mother was presenting or explaining the situation to us. Since 2 years old, they're not really talking much. So mother states that her daughter is having a chronic dry cough, but it gets worse, or it starts with exercise. Like if her daughter went out in the backyard and was running around, she'd just instantly start coughing. And since the month now is November, we're in Arizona, the weather has turned, it's gotten much colder, and the mother states that since the weather has turned, her daughter's just like coughing nonstop. And at times it'll get so bad that she leans forward and kind of postures to try and breathe better. And she says that the patient has no medical history, she has no allergies, but the mother of the patient and the father both have asthma. So mom was bringing concerns that maybe her daughter had asthma as well. So mom did deny any recent upper respiratory infections, fever, chill, decrease in appetite, anything of that nature, like no nausea, no diarrhea, no signs of infection. So let's see. Parents state that rest will typically relieve the coughing fits, and like I said, the exercise in cold weather aggravates it. So review of systems. Denies fever, chills, malaise, fatigue. Eyes, denies visual changes, redness to bilateral conjunctiva, denies any discharge to bilateral eyes or any trauma. Ears, nose, mouth, and throat. Of course, this is the mom. She's saying she hasn't seen or noticed any changes in her hearing, any pain, discharge, runny nose, nasal congestion, nothing like that. No appearance of having a sore throat. And then cardiovascular, denies previous concerns, no presentation of possible palpitations or anything like that, no gripping at the chest. Mother states she does not think that her child is having chest pain. Pulmonary wise, admits to situational coughing, wheezing, and shortness of breath on exertion. Past medical history, no known allergies, no medications, no medical diagnoses, preventative care up to date on all of her vaccines, has come in for all of her well-child visits, no surgeries or hospitalizations. Family history, mother and father and one younger sibling are all in good health, except for mother and father having asthma. So social history-wise, not the most important in presenting, but the family doesn't have any pets, so that is something that I would ask if I had a patient with asthma, because that could be a trigger if they're allergic to cats. That could set something off, and if they have a cat. So I included in the social history, like her diet and whatnot. But if I were presenting this to a provider to give report, I probably wouldn't include that. Let's see, vital signs were stable, heart rate 90, blood pressure 95/60, temp 98.6, respirators 26, SpO2 99%, and she's in the 50th percentile with a weight of 12 kilograms and a height of 85 centimeters. We did not order any labs or radiology at that time. Physical exam, constitutional, pleasant, cooperative, and well-nourished, and no acute distress. Eyes, perla, normal conjunctiva, and let's see, ears, nose, mouth, and throat, clear canals, pearly, translucent, tympanic membranes bilaterally, grossly normal hearing, etc. Basically, everything was normal. Cardiovascular, normal rate and rhythm, no murmur, gallop, or rub, clear S1-2. Pulmonary, clear to auscultation to bilateral lower lung regions, however, expiratory wheezes heard to bilateral upper lung fields. Anteriorly and posteriorly, however, no signs of acute respiratory distress, no grunting, flaring, or retractions. So my differentials I came up with are asthma, bronchitis, and foreign body in other parts of respiratory tract is how it comes up in the ICD-10 website. I put that in there because she's 2. She could have inhaled, I don't know, a bobby pin, a marble, a penny. So that's always, something to watch out for the younger kids. So we went with a diagnosis of asthma. So the plan for that, we sent them home with a home nebulizer, and we gave them nebulized albuterol, 2.5 milligrams per 3 mLs, 0.083% inhalation every 6 hours. And then we gave education on the pathophysiology of asthma. We gave her like a pamphlet to take at home to read further. And then follow-up, we said go to the ER for severe difficulty breathing or bluish color of the lips or fingertips. And we did refer her to pulmonology for PFT. So the clinic that I'm at, we don't do spirometry, so we have to refer her for that. And we're also sending her so that she can develop an asthma action plan, which is super important for these guys to know what to do when they're experiencing symptoms. And then we also sent her to allergy testing just to see if she has any, and if she's allergic to dust and they have carpet, they might need to take the carpet out, or like I said with the pets, just to eliminate those potential triggers. So yeah, that was my interesting patient case of the week.